Keeping schools open and offering regular in-person instruction has been an ongoing challenge ever since the start of the COVID-19 pandemic nearly 2 years ago. At the start of the current school year back in September, there was hope that despite the Delta variant, schools could navigate their way through. But the highly communicable Omicron variant has been a big challenge. One strategy to minimize the spread of the virus was a testing process known as Test to Stay. Under that, unvaccinated students who share a class with a student who tested positive are asked to test for 5 consecutive days before being allowed back into classrooms. Vaccinated students and school staff are given 2 rapid antigen tests and asked to test on the 4th and 5th day after the exposure. The new system is intended to help schools, which have struggled to keep up with the rapid spread of Omicron and the resulting widespread staff shortages. To find out how this and other testing is going locally, we talked with Randi Lowe, the school superintendent of the Bennington-Rutland Supervisory Union, and Mark Tashjian, the headmaster at Burton Academy. What's changing with the testing guidance, and how is that working in the BRS schools? I mean, the Secretary Dan French was on at the governor's press conference on Tuesday, outlining some changes that would be coming. But I guess I was just wondering if you could walk us through what those changes are and what they're going to look like here on the local level.
Mm-hmm. Sure, it's a good question. And it's an important one. So I, in my mind, see the updated changes sort of in 2 main areas. The first area is related to contact tracing. So right now, our school principals and nurses spend a tremendous amount of time determining the close contacts for a positive case in our schools. And there's different responses based on vaccination status. So they have to generate letters, they're communicating information, very clearly given direction to any close contacts about what they should be doing, the timelines, answering questions. They have to develop a line list that they then put in a specific format that get uploaded in secure server to the Department of Health. It's a very time-consuming process. And by time-consuming, I mean hours and hours per case. And communicating the close contacts, communicating with the school, communicating with the greater community. And I do that less than we did in the past. So that will be changing, and it will essentially be a communication to families and employees, but families primarily, that said, somebody in your child's class tested positive. Here's a link to what you should be doing. And so the responsibility of following the guidance now is transferred to the families. They would go to the Department of Health site and they would read what they're responsible to do, and they would be doing it. So that the responsibility and the time that our staff have to engage in this work greatly decreases. Okay, so responsibility shifting from school to home to take responsibility for that. The second area is around testing. So we surveillance testing, PCR surveillance testing is ending. That is something that we did not do in the BRSU, so that's not a change for us in practice. But again, what is going to happen is we have been doing test to stay, which are rapid antigen tests. And so any students or staff who are a close contact and unvaccinated have been able to come to school and get tested using a rapid antigen test. And if they're negative, they can stay in school. That has been happening for about the last month and is an incredibly time-consuming and complicated process. It requires a lot of organization, communication with families about when to come. We've had central office staff deployed to be supporting that work when numbers get high. And I can personally say that, we had a high number earlier this week at MEMS, and I think the whole process took almost 3 hours to just get through the testing. And so again, now this is another very time and labor intensive process that will be ending. And what we'll be transitioning to are our antigen test kits that we give to families to say, please administer this to your child before school. And if it's negative, they can come in. If it's positive, you need to keep them home, and then follow the guidance on the Department of Health site about what to do when you test positive. So everything is shifting from the onus of responsibility on the schools to a transition to families managing the response and care of children.
Then we headed up to Burnburton Academy, where we caught up with headmaster Mark Tashjian.
Well, first of all, I think that there's been tremendous responsibility that is exhibited by families since the start of this thing to monitor symptoms and keep kids home if they're showing any symptoms. So I think there's a very strong perspective that this is not a significant change. Families have always been responsible for monitoring symptoms. And in this case, with take-home rapid tests, all we're doing is counting on those families to test their kid if they're showing any symptom or have had a close contact to make sure that they don't come in and infect others. So I don't see that part of the guidance. I don't see that part of the guidance as a major change in policy. Regarding the surveillance testing, we're going to continue with surveillance testing. We have the supplies, and from my standpoint, it can't hurt and it might help. I understand the Agency of Education's position that PCR testing takes 24 to 48 hours to get results back, and they would rather people take rapid tests. But you need to have the rapid tests available in order to use them. Right now, we have additional PCR test kits available. So we're going to keep surveillance testing with the notion that, if we pick up some asymptomatic positives, good for us, and it'll help us to protect the community, and it really doesn't cost us anything. So we want to continue to do that. I really want to emphasize that I think the guidance coming from the Agency of Education and the state has been really, really helpful to enable in-person learning. And so we stand ready to adapt to the latest guidance. And I think everyone wishes Omicron would go away. And I would say we all look forward to the day when it does. It will eventually. And meanwhile, we also recognize just how important it is that students be able to come to school and have a normal rhythm and be educated and have the socialization and the athletic opportunities, the artistic opportunities, all the reasons why school is such a rich place to attend in person. That's what we're trying to protect. And I know that our state leaders are trying to do that as well.
So you're feeling comfortable you have a sufficient supply of the at-home tests to distribute, or the parents will be able to obtain them one way or another?
No, I should clarify. We have supplies of we've been doing weekly PCR testing. Okay. And what that involves is every Wednesday morning, our students and faculty come in and you do the nasal swab that we've all gotten used to, and you put it in a little tube and seal it up, and that gets sent to a lab. So it's not a rapid test. It's a very accurate PCR test. But the downside of the PCR test is that it takes 24 to 48 hours for it to get to the lab and get processed and get results. The beauty of the rapid test is it's 15 minutes later, you know where you stand. But we also recognize that the rapid tests are not quite as accurate as the PCR tests. So they each have their strengths and their limitations. Yeah, I mean, if someone's not experiencing symptoms, either an adult, if a teacher has tested positive, they're able to teach remotely to a classroom that's here, if they're able to. If they're feeling up for it, we're happy for them to do that. We welcome that. And if students are isolating and quarantining, they're also welcome to Zoom in and attend class. Again, if they're feeling up to it. If they're not feeling up to it, they should rest up and get healthy. So we're trying to be flexible. And if there's one thing we've learned through this pandemic, it's that we all need to be flexible in our thinking and in our actions, and just we just keep adapting to the latest situation. And I look forward to the day when we are not being quite as adaptable. But these are the times we live in, Andrew.
The Omicron wave, which began hitting area communities in December, may be showing signs of peaking. But if there's one thing we know by now, it's that the virus is unpredictable, and learning to live with it is one approach gaining more currency. For the GNAT-TV News Project, I'm Andrew McKeever.